guys, my name is Laura. Today I will be talking about the main difference between the NHS and the Spanish health system from a nursing perspective. I graduated in Spain 6 years ago and I started working there for about a year before I moved here to the UK. But why did I make such a life-changing move? Well, let me share with you the main reasons why I believe the UK system appealed a lot more to me. First, I would like to mention the difference in between contracts. Once you graduate in Spain, if you want to work in a public hospital, you have to join a public list where you are just a number. The more experience, courses, masters, or publications you have, the higher you are on that list. That is the list used when there is a lack of permanent nurses. They use the nurses on that list to offer short-time contracts. When you finish university, obviously you don't have any experience, which means that you will be on the last part of the list, so you will be offered not great contracts. The way to obtain a permanent contract is doing an exam. For example, if there are 200 permanent posts available, the best 200 marks will get contracts. The mark you get will be half of your experience and half the note of your exam. In the UK, in my case, I was offered a permanent job while I was still in Spain. I had to pass some interviews that in Spain don't exist, but I was offered a permanent contract straight away. This was the first main reason why I decided to move to the UK, as at the beginning of my career, I just managed to work with contracts that were from 1 week to 2 months maximum length. Secondly, the chance of changing a specialty. In Spain, as I mentioned before, if you are not on the top of the list, your chance to get a decent contract is low. The system works with phone calls. They call you and they offer you, for example, 3 contracts and you choose one. But if you refuse to work because maybe you didn't like the contracts available or, well, if there's not a good reason, you might get a penalty and you might not be able to work for 2 weeks. So if you are not on the top of the list, it's very hard to choose where to work. But if you have more points and your position is higher, there is a meeting where the long contracts are offered and you can choose easier where to work. But as I said, you must have experience or maybe a master to join that meeting. In England, I first started with a contract in elderly care, but it wasn't hard at all to change a specialty. It was as easy as applying for an interview. In my case, I moved to my favorite field, which is haematology. That's where I wanted to work from the beginning, but I just couldn't. So after 6 months after starting in the NHS, I had the chance to change. So in that aspect, I think the NHS has a smoother process than in Spain. The third difference is about the promotions. There are no bands in Spain. You are just a nurse. And depending on your experience working in the same place, you will get pluses as extra money. Of course, on the wards, everyone knows who has been working there for a very long time and has a higher level of expertise, but yeah, that just only works in practice, as that nurse will not get a promotion. Also exists the ward managers, and it's a similar role as in the UK. In the UK, we know exists band 5, band 6, up to band 9. There are so many levels of nurses, and I like the fact that you can promote not only for your experience, also for your expertise and your knowledge. My fourth point is about teaching. In Spain, you can educate yourself as much as you want, but all will be paid for you. There's a possibility in some cases to apply for some scholarship, but that is up to each nurse. Usually the hospital will not pay for any formation for the nurses. Normally it's due to economical reasons, but actually that doesn't stop the Spanish nurses to keep learning. But in England, there are many opportunities to develop yourself inside of the hospital and outside. Frequently, the hospital will help financially or will offer some study days. In my case, all of my courses have been funded by the hospital. I started from infection control courses at the hospital and I finished doing specialized hematology courses at the university. And I am so glad for this, as it was what helped me to get promoted. Now let's talk about money. In Spain and England, the salary for a nurse goes hand in hand with the cost of living of each country. They are similar, but the holidays, no way. In Spain, of course, depends on the length of your contract. If you have a year contract, you will get 22 labor days, which means more or less a month. But if you have a 2 months contract, you will just enjoy 5 days of holiday. That means 2.5 days per month. But here, the staff can expect up to 35 days off per year, including the bank holidays. And that's a huge difference. My last point is a very important difference for the nurses. I'm talking about the nurse-patient ratio. This is the minimum number of nurses in charge of a certain number of patients. We could also name it as nursing workload. A high ratio means that in a normal ward, let's say renal, where the patients are not extremely acute, a nurse looks after 10 patients each, whereas a low ratio could be on the same ward looking after 6 patients. Like when we're sort of staff on the wards, the nurse-patient ratio increases. Obviously, both countries depends on the acuity of the patient, and this doesn't include intensive care or A&E. Spain has the highest nurse-patient ratio with 12.5, but the UK has an average rate of 8.8. To finish with this topic, I would like to mention that the experience for Spanish nurses that work in the UK up to 2021 was accountable in Spain. What I mean with this is that in the mentioned list, if you work 2 years in the UK, meant as if you work in Spain for 2 years. That experience helped you to go higher on the list. But after Brexit, as the UK is not part of Europe anymore, this situation changed. There's no official communication confirming this yet, but the theory is that the experience is just accountable in Spain for nurses that work in other European countries. This might pose to some Spanish nurses if they want to keep working much longer in the UK, if they don't want to stay forever in the UK. So as you can see, the work conditions for nurses in the UK are overall much better than in Spain. Obviously, every hospital is different and there will be many exceptions to my points, but I think this is a general picture for you guys to understand the main difference in between the NHS and the Spanish health system.